Hi all, some random leftist here, back with my regularly scheduled video. Pestilence, war, famine, death, the four horsemen of the apocalypse, and four defining features of any capitalist nation. In this video, I'm going to be talking about how these four concepts manifest themselves under capitalism, and compare them with various socialist experiments. As a side note, I'll be using capitalist sources all throughout this video, to try and prevent any accusations of false data. I'm also not a scientist or a doctor, so if I make any errors in my assumptions here, feel free to correct me. Let's get started. Pestilence or disease. If you're from a fairly well-off Western country like myself, the concept of widespread disease is almost foreign. You get sick, but there's doctors and hospitals and over-the-counter pain relief. Even in the hyper-capitalist USA, there are free clinics available for poor people. But how do other nations deal with disease? Are we in the West really that better off? Let's have a look at the USSR and Cuba for comparison. First off, Cuba, well regarded as a pioneer of healthcare, even among capitalists. As of 2011, Cuba was outperforming America, as well as its neighbouring capitalist Caribbean countries in most aspects of medical care. Let's take a look at the statistics. As you can see, Cuba spends $503 per capita on healthcare, about the same as their neighbours, and way below the $7,400 spent in the US. The life expectancy, however, is more comparable to the US, only a year below for female and combined deaths. I won't go over each statistic, but as you can clearly see, Cuba beats the US in quite a few areas, and in any case is more comparable to the superpower than to their capitalist cousins in the Caribbean. Cuba is also renowned for their medical research and foreign medical aid, a treatment for tumours, cancer research, and pioneering in the prevention of mother-baby AIDS transmission, all under blockade. Cuba has a doctor for every 170 residents, and provides more doctors and nurses to the developing world than the US and its allies in the G8 combined. Okay, so Cuba does well for its citizens in regards to medical care. One speculates that this will continue to rival the US as more advancements are made. Now, how about the USSR? As early as the 1930s, citizens of the USSR could expect to visit the doctor up to 10 times a year. In 2013 in the UK, the average citizen visited the doctor 5.5 times a year. While this can perhaps be understood as larger health problems and less preventative medication in the still developing USSR, it's still an impressive number. Services provided at the workplace by factories, trade unions and farms included first aid stations, physical screening stations, treatment facilities and personnel. As well as this, there was a huge rise in rest homes, sanatoriums, health clubs and other amenities. The number of hospital days per 1,000 population per year in 1972 was 3,000 in the USSR, compared with 1,000 to 2,000 in the West. In the same study that revealed this comes this quote by Odin Anderson. What I find overwhelming is the seemingly lavish use of personnel, particularly physicians, and the great number of specialised hospitals, beds, polyclinics and programs. The result, of course, is a very high use of services compared with Western countries. So, when compared to the West, Cuba and the Soviet Union did well. But this video isn't about how well they compared to the US. It's about why capitalism is the harbinger of pestilence. To understand that, you have to look at other capitalist countries. You remember that chart from the section on Cuba? Both Haiti and the Dominican Republic are capitalist, and yet look at the difference between both them and Cuba and them in the United States. If America is a winner in capitalism, and even then a winner where the vast majority of its population aren't, then Haiti, and for that matter the vast majority of the global south, are the losers, destined to have their resources stolen, their infrastructure rot and their people starve, because it's profitable for a few to do so. Now, there's an argument often made by capitalist apologists that ignores the material conditions of socialist countries. Cuba, for a start, is under blockade, and the Soviet Union, even in the 70s, was trying to modernize a backwards country that in the early 1900s resembled a medieval Europe. When taking that into consideration, both these countries were and are vastly superior in healthcare to their capitalist cousins. Now, I won't be mentioning the problems with healthcare in America. I would refer you to Dr. Richard Wolff's interview on RT for that. Instead, I will talk about some of these comparative countries and how and why capitalism doesn't feel the need to help or cure some of their problems. Well, actually, I can sum it up right now. It's because it doesn't make any money. When the Ebola crisis hit West Africa in 2013, there was a sudden worry that it would spread to the West. At least 11,000 people died during the 3 years that the virus raged. Eventually, a team of doctors from all over the world managed to contain the virus. And even though it is still killing people, it's nowhere near as bad as it was during those years. But why all this fuss over Ebola? It's a scary disease and fairly deadly, but malaria kills just as much. Well, economics. The World Bank claimed $1.6 billion in productivity were lost in the 3 most affected West African countries. Some companies lost almost half of their workforce. But Ebola had been building up for years, and the underlying causes of poor infrastructure and a limited medical staff in West Africa were not and still have not been addressed. Ebola emerged nearly 40 years ago. Why are clinicians still empty-handed with no vaccines and no cure? Because Ebola has been historically confined to poor African nations. The R&D initiative is virtually non-existent. A profit-driven industry does not invest in products for markets that cannot pay. That's World Health Organization Director General Dr. Margaret Chan. As soon as Ebola became a global spectre, as soon as the prospect of European or American deaths became possible, it was crushed. Investments from the World Bank and foreign aid don't seek to make sure such a situation never happens again, but they seek to get a greater control over West Africa's economy, so that in the event of Ebola, it will no longer spread overseas and become an inconvenience. In a capitalist nation, there is no incentive to prevent disease unless it is a threat to the economy. That's why the West only intervened when their own countries were threatened, and it's why their payback is neo-colonialist control over West Africa. There is more than enough healthcare to go around, as we can see by the example of Cuba. Yet we live in a society where millions are condemned to die from preventable illnesses because their deaths make little to no difference on the economies of the West. Capitalism breeds disease by its inaction and indifference to so-called unproductive human beings. There is only one solution that will bring about a fairer, cleaner, and healthier world: socialism. Thanks for listening. Part 2 will be out soon. We'll be talking about war. I have a Twitter account now, and you can follow me at @SomeLeftist. Leave your thoughts in the comments and make sure to subscribe and like this video if you'd like to see more. Thanks very much, comrades.